Okay, so what I really want to show you is now that we have those two pieces of data, the cone beam CT of the patient's bony anatomy and the intraoral scan using the Carestream 3600 intraoral data, we can layer those two pieces of data on top of each other using this software through Bluesky Bio. Once those are layered, I can place my implants digitally and plan the entire surgery that way. First thing we want to do is locate our intra-alveolar nerve here on the right side and left side. And just for simplicity's sake, I've already planned this surgery, but I'm going to go through the steps with you so you can see how I do that and the power of this software. Left nerve. Okay. So at this point, we're going to take that intraoral scan. You can see it in green here. It's going to layer on top of the CT. It might pop it, cancel. We're just going to keep rolling, but you can see how intimately this software is able to layer that scan on top of the bony scan. So we know, looking at this, we're confident that those are met up perfectly. We can move forward. This is a really neat vantage point too. We can look and see where that nerve is floating in relation to the teeth. I then can come in and add, digitally add teeth where we're going to replace teeth with implants. Once I have that tooth location proper based upon arch and the opposing teeth, the bite, I then can place this implant in relation to that tooth. So we call that prosthetic guided implant placement. That tooth is the prosthesis. And so moving from there, we have confidence that the implant is in the perfect location for the tooth that we're designing. Move forward from there. This check, once we've got that implant in place with the tooth location, we want to make sure we're in good, healthy bone for that implant placement. I can basically, if you imagine, look on this right side of the screen, I'm able to put myself in the long axis of that implant and rotate around it and make sure that I'm in bone all the way around. I can visualize my nerve passing underneath and to the side of the implant as I come around it. This tool alone saves me so much time and makes it so much safer for the patient because we know we're in good bone, we know we aren't going to run into the nerve, and we're away from any risky anatomy. And then you get a good visualization of it to the left. It then steps through some procedures to allow us to design our surgical guide. And I'll show you how I do that. So now this will take away some of the undercuts. We're going to quickly draw a curve for a surgical guide. Just never very good at video games, so bear with me. Let's combine those. Okay. Very good. Got our curve drawn for the surgical guide, and it's just going to fabricate that. So while it's doing that, I can kind of show you what the final piece looks like here. And this was designed by the software. We then send that file, it's called an STL file, to our 3D printer. And it has the angles and the depth and the location built into it. It'll fit over the teeth, and that keeps my drill sets exactly in line with where I've placed them in the software. Also to the correct depth. I just step through my drills once I've got this in place. It makes it so much faster for the patient, so much more comfortable, and a lot of times I can be a lot more precise, obviously, to where I don't have to do as much bone grafting as I had to in the past, because it allows me to put that implant exactly where I want to. Looking back on the computer screen, you can see in that lighter red color what that surgical guide looks like digitally. So it's a very powerful tool.